Good afternoon, everyone. With quorum present, the Maricopa Continuum of Care Board meeting is now called to order. Please turn on your microphone when speaking and mute when you are not speaking. The MAG public comment process allows members of the public to comment on items on today's agenda or on items that fall under the COC's purview. If you would like to comment at today's meeting, please fill out a white request to speak card located at the information table and provide it to the MAG staff. If you parked in the garage, and need parking validation, the validators are available on the information table. If you purchased a transit ticket, please see MAG staff and they will assist you. Hearing assisted devices are available for MAG staff. Katie, would you like to take roll call, please?
Thank you, Co-Chair Phillips. Jacqueline Campbell. Jessica Cruz.
Present.
And your organization, Jess.
Native American Connections.
Thank you. Liz DaCosta.
Liz DaCosta, Housing Program Administrator with Access.
Thank you. Lisa Glow. Chris Hallett.
Present. City of Peoria.
Thank you. Michael Hughes.
Present. A new leaf.
Natalie Lewis.
I'm here, City of Mesa.
Thank you. Sean Pierce.
Sean Pierce, Maricopa County.
Thank you. Charles Sullivan. Cricket Weatherington.
Here, Arizona Housing Inc.
Thank you. Danielle Wright.
Here, Arizona Coalition to End Sexual and Domestic Violence.
Thank you. Co-Chair Rachel Milne.
I'm here, City of Phoenix.
Thank you. Co-Chair Vicki Phillips.
Present, Vicki Phillips, CBI.
With that, you have a quorum.
Thank you very much. All right, the next item on the agenda is a call to the audience. This is an opportunity for the public to comment on items that fall under the Continuum of Care Board that are not on the agenda or that are on the agenda for discussion, but not for action. 15 minutes will be provided for the call to the audience agenda item, unless the committee requests exception to that time limit. Katie, do we have any requests at this time?
Co-Chair Phillips, we have not received any public comments nor anyone from the audience ready to speak.
Thank you. Right, our next item is approval of the consent agenda. It's items 3A and through 3B. Does any member, go ahead, I'm sorry. Does any member of the board have any questions, comments, or request a presentation on any of these items? Does any member of the public wish to comment on any items on the consent agenda? All right. May I have a motion to approve consent items 3A through 3B?
This is Rachel, so moved.
May I have a second? Second. Thank you very much, Rachel and Natalie. Is there a discussion of the motion from the board or comments from the public? Okay. For those in the room, we will take a voice vote. Those in favor, please say yay. Yay.
Yay.
Those opposed, please say nay. Okay. I'll now ask Katie to proceed with the roll call for those joining online.
Liz DaCosta.
Yay.
Co-Chair, your motion passes unanimously.
Thank you. Okay. So next item, we're going to discuss some updates. So just a quick reminder that updates for all committees were included in the COC newsletter and can be found on the MAG website. I'd like to introduce Dylan Belmont, here to provide an overview of the legislative activity as the session closed.
Thank you, Co-Chair Phillips. Quick update for everyone. The legislature returned for about 2 days earlier this month. Session still hasn't ended yet, and they did pass one bill that was related to housing. That was the elimination of the rental tax. Although it hasn't been signed by the governor yet. It may sound somewhat familiar. We saw it earlier in the year, back in February, I believe, when it was vetoed by Governor Hobbs. So yet to see what action will come of that. We did not see any other development on either affordable housing reform or zoning reform. Those were two of the discussion points that some thought might be aware at that return to the legislature, but nothing happened there. There was also one last thing, another bill, SB 2649, that failed. That was the one related to encampments, requiring jurisdictions to provide some sanitary facilities or otherwise close down the encampments, but that did fail. So legislature is once again recessed, but they're set to return on July 31st. And with that, I'm happy to take any questions.
Thank you very much, Dylan. All right, moving forward, we'd like to introduce Andrew Irwin from Solari, who's here to provide an update on the sober living response.
Good afternoon, everybody. Thank you for having me. Possible, I've got a presentation, so I'd like to share that. Try.
Andrew, you should now be able to share your screen.
Excellent. All right, is everyone able to see that? It should say top slide with sober living facility on it.
Yes.
Yes.
So I think everyone probably has some awareness of the situation. Access became aware of a fraud that was being committed relating to Medicaid, specifically sober living facilities that were targeting Native Americans. The governor's office and the access team contracted with Solari to give the primary response. And what we did is we put together a 211 hotline, as well as providing temporary shelter for individuals that were being displaced because of the closure of sober living homes. So what I'm going to do is go through some statistics and then answer any questions that you all might have. So far, we've received 5,748 phone calls through our 211 hotline. We set up a specific number just for individuals affected by the sober living home closures to call into 211 and press 7. They're then connected with our staff who help triage the situation. They're looking to ensure that the individual is eligible to receive services through AIHP and that they've been affected by a sober living closure. We verify that by looking at claims that have been made through access for particular individuals. The vast majority of the individuals that are calling us are calling for resources, so they are looking for housing or transportation. There have been reports of missing persons, abuse, and neglect. And there have been occasions where they've requested us to come out on site and provide support face to face. At this point, we've provided 7,481 nights of lodging to individuals and their families. We've provided transportation to 390 individuals. In total, it's been 2,000 individuals that have been served. The transportation has been transportation not only from the facilities to our temporary shelter, but also home. There's been numerous occasions where individuals have asked to go back to their tribal communities, and we help coordinate that transportation on their behalf. So this slide is showing the enrollment statistics for the people that have contacted us because they've been impacted. We can see that there's some pretty significant outliers here in the data set. The Navajo Nation as a tribal community has been impacted the most, with 361 individuals contacting us for assistance. What was interesting to us and what we weren't aware when the project began is the number of non-Native Americans that have been affected by this fraud. So what we can see is that 1,017 individuals who had no tribal affiliation at all were contacting us for assistance. What that really showed us was that there was actually a fraud that wasn't just targeting Native Americans, but just individuals in particular that were looking for housing. So when we began the project, it was our understanding that the response was going to be likely limited to a majority of tribal members. And further, that those individuals would be looking for treatment. As we got into this process, what we found is that the vast majority of folks were not actually seeking treatment and that they were looking for housing. And then on top of that, over 50% of the individuals were not tribal affiliated. So the way that the fraud was perpetrated is that there was groups of individuals that would go out and look for folks that would be willing to come into a sober living home. They would ask for them to switch their health plan from a standard health plan over to AIHP because there was less oversight, and that's how they would perpetrate the fraud. So what we can see here is that We have that high number on the right with 1,017 non-Native Americans. And then we have a very high number on the left down below where we see that there was 893 individuals that were enrolled with AIHP. So as those individuals are being identified as not actually qualifying for AIHP services, Access is changing their enrollment and putting them back to one of the plans that they would qualify for. Any questions about that? Okay, I've got some more specific statistics just in terms of volume so people understand the scale. So in the past week, we had over 1,000 calls coming through the hotline. Those are being live answered. Those are being managed by our 211 staff. As folks might be familiar, we were doing a significant amount of housing work with Maricopa County, specifically diversion. So we had a majority of the staff come over and assist with that. And then in addition to that, we just wanted to give some statistics. We have 386 rooms that are contracted with 4 separate hotels that are spread throughout the valley. Of those, we had 217 occupied as of the 21st. We had 58 available. We've been trying to stay ahead of the demand, and that's been difficult at times, but it seems that the amount of individuals seeking housing at this point has dropped off. And then we've got just some statistics on average length of stay. It's currently 13 nights at the hotel as is the average, and our longest was 33 days or 33 nights. And then we have a whole group of folks that have come together to provide food for the individuals that are staying in these temporary shelters. Valley of the Sun United Way, St. Vincent de Paul, St. Mary's Food Bank. They're bringing in meals, hot meal and cold meals. And they've been the ones that have really helped us along as this has gone on and made it a sustainable process. All right, well, that was my update. Are there any questions?
Andrew, can you stop sharing your screen so we can see you again?
Sure.
Thank you.
I just had a quick question back to, I think it was your first slide, Andrew. There were 7 deployments. Can you describe what a deployment is?
Sure. We have a retrofitted RV. We call it our tragedy response vehicle. It's a vehicle where we can go out on scene and offer support to individuals that are having some sort of situation in the community. So 7 times we've gone out to sites where there's been an investigation or a large group of individuals that were going to be affected by the closure. So last week, for example, APS went out to 26 homes that were owned by a single entity. And they were checking in on the individuals that were currently in those homes to see if they were safe, if they could leave on their own accord. And so the vehicle was deployed to give support to both the APS officers and anyone that wanted to leave those homes.
Wow, thank you.
Any further questions or discussion from the board? Thank you, Andrew. Does any public have any questions or comments? Thank you. All right. Amy St. Peter, Deputy Executive Director with MAG, will provide an update on the Regional Affordable Housing Education Campaign. Welcome, Amy.
Thank you very much, Madam Co-Chairs and members of the board. It's a pleasure to be here. I appreciate all of your assistance with developing this campaign. It's good to see you. Your feedback has been really important to this campaign. The idea of a public education campaign came about, well, it's been thought about by many people in different circles, but very specifically as part of Pathways Home, which is the regional homelessness action plan for local and tribal governments. And we realized that as we're addressing homelessness, we have to be addressing housing. We simply can't solve homelessness without housing. And one of the barriers, not the only, but one of the barriers is, or the opportunities is to increase acceptance of affordable rents and mortgages throughout the entire region. Because when communities are more accepting of housing like this, then it's easier to cite and it's more successful in its implementation. And so engaging the public has been a key component of the plan and part of what will help to make it more successful. So we started working on this about a year ago. And then last April, so just over a year ago, we fully integrated our efforts with Home Matters to Arizona. So at the same time that we were talking about and starting to develop a campaign, they were also doing so with a number of different stakeholders. And so we realized that it's just not a good use of resources if we have dueling campaigns. It will confuse people in the marketplace, and we don't have enough time or money to duplicate effort. So we fully integrated these two efforts, and then we developed this campaign. We did so on the basis of extensive research, as well as community engagement. We've been before you before and the committee, and we've received feedback. And we're at the point now where the campaign is launched, and we hope that you'll continue to partner with us and that you'll help to promote this campaign. And part of what we're trying to do is to reshape the narrative, and we hope that you'll join us in that effort as well. So my purpose in being here today is to share with you the toolkit for the campaign and to answer any questions, receive any additional feedback that you might have. Next slide, please. So I want to ground this conversation in terms of why and what. So the why behind the campaign is making sure that every Arizonan has a place to be at home, and understanding that when people have a home, they're much better positioned to live stable and purposeful lives. It's much more difficult when somebody does not have a home, as I know all of you are very acutely aware. And so what we're trying to do through the campaign is that we're trying to cultivate champions. We're doing so in every community, in every sector, because it takes everyone working together to truly make progress in this space. Next slide, please. And so we have both a long-term vision and a short-term vision. A long-term vision is that the new framing is being used. We want to reshape the narrative. We understand that, unfortunately, the term affordable housing can sometimes stop more conversations than it starts, and we want to change that. We have to have a shared language, a way to speak with people across disciplines, across sectors. And so we're wanting to reshape that language, and I'll be sharing a bit of that a little bit further into the presentation this morning. In doing so, we really need to and are very focused on building coalitions of support. It's not up to any one sector, and it can't be solved by any one sector. So we have to be working together in this space. The end result of all of that is twofold. One, that there will be more attainable housing options in every community across the region, that every community will have a more diverse array of housing options for their residents, both housed and unhoused, in the hopes of getting all of them housed, and that there will be fewer barriers to stable housing. Next slide, please. And so our objectives then is transforming that narrative, creating that network of supporters, and making more housing options a reality in every community throughout the region. Next slide, please. So these are the strategies. The first one is to continue working in collaboration with you. You have deep expertise in circles of influence. And we hope to be able to leverage that to make an impact. It's been essential focus of the campaign that we're telling real stories, that we're talking about real people right here, that we're not that we're able to convey the struggles that people have trying to access affordable rents and mortgages here, and also able to convey the very positive impact that's made in people's lives when they do have access to affordable rents and mortgages, and then to expand the campaign message. And we hope to have your help with that. We have a toolkit now that's available, and we hope that you'll link to it and use it. And we've been partnering with people in a variety of different fields. So in addition to the housing space, we're also working very closely with folks from the healthcare field, education, and various levels of infrastructure. Of course, we want to reach every person, and we want to engage every person in this campaign, but we have 4 very specific target audiences, and this was on the basis of feedback and research. The first one are the elected officials and the community leaders. They can open doors that we can't necessarily, and so we're hoping to engage them very directly in this work. Also, really wanting to engage the developers because we understand that housing, the barriers that we're seeing to housing right now, it is at least in part a supply issue, and we have to have developers on our side as we're working towards these goals. We also want to be able to reach out to homeowners associations, neighborhood groups, because they can help us to expand our reach. We have limited dollars for marketing, and really hoping to leverage and extend our reach through people who have access to larger groups as well. And then the likely voters, that we're reaching folks who are voting, who are active in their communities, and who see that civic responsibility. Next slide, please. So this is how folks can get involved. We have 3 different ways, and I'll go through each of these. But the first one, kind of the entry level, is to engage, to learn about the campaign, to download the toolkit, start using the toolkit. The second one is to promoting the campaign. So anything that you can do, whether it's posting something about this on your website, including information about this in your newsletters, sharing this through social media. There's a variety of different ways to promote the campaign. And then the third is the most intensive, and that is collaborating very directly with us. We have have an oversight team, and Amy Schwabenlander is on that team as well as others. And it's important that we hear from you what your priorities are so we can help to meet those needs through this campaign as well. Next slide, please. So this is a little bit more detailed then for each of those 3 areas, and we hope that you'll work with us through all 3 of these areas. The first one really is changing the affordable housing language. As I said, affordable housing itself, people tend to think of a type of housing, and then there are misconceptions and stereotypes about the people who live in that type of housing, and it's often very negative. And so instead referring to affordable rents and mortgages, homes within reach, homes that meet our needs, and defining needs very broadly. So there's a variety of ways that we all can get involved in this campaign, just even on a personal level, on an individual level, in addition to the organizational level. We do hope that you'll add content about this to your website. We've made it really easy through the toolkit, and we'd be happy to provide, if there's something else that you're needing, let us know, and we will try and accommodate that as much as possible. And again, sharing the word through emails and social media, we do have samples for that in the toolkit. Next slide, please. So this is that second level then. We are thankful. We've had a number of communities as well as Virginia G. Piper Charitable Trust actually provide funds. We will have regional media buys starting this fall. And that's in addition to whatever local communities and organizations might be able to do on their own. And so if you can help us to spread the word, you can do so through your own networks, as well as by providing funds for that regional campaign. We do have $105,000 collected so far, and we're excited to be able to work with Cox Integrated Partnership. Through Valley Leadership, we're able to leverage that partnership with them. And so we're providing funds to them, and they are at least doubling those funds for us through their in-kind contributions to this campaign. So they're helping to develop the collateral for the campaign. They're helping to develop the website for it. They're going to film videos for us. So they're adding a lot to this, and they're able to help us stretch our dollars in a really good way and in a way that we wouldn't be able to on our own. And this last bullet point, this is a very immediate need. If you can please help us to connect with people who have been affected by having or not having affordable rents and mortgages, we'd love to include their stories and to reflect those on our website and to include those in the toolkit. So if you can help us to connect with people, some ideas could be maybe an older adult who's been renting and they can no longer afford the rent because it's increased so much. Maybe there's a veteran who's trying to come back into the community after having served our country, and they're just not able to find that affordable rent or mortgage, or they finally did, and this is how their life is better as a result. It could be a single parent. It could be, I used to work at a shelter myself when I qualified for food boxes, so it could be our colleagues, our friends, our neighbors who are just really struggling right now. And we want to tell their story because we want people to understand. It's interesting. I was presenting on homelessness and housing just last week and provided the stat that a lot of people who are experiencing homelessness right now are actually working, and they're working full-time jobs, and they still aren't able to get into that affordable rent or mortgage. And that shocked people. So the more that we can let people know about how our unhoused neighbors or struggling neighbors are facing a crisis right now, the more that we can cultivate champions among them and have them really engage in this work with us. So if you do have ideas for stories, please do reach out and let me know, because we're actively looking for those, as well as for photographs. Next slide, please. And then collaborating. We would love for you to work really closely with us on this. You can become a trained spokesperson. You can help us to message this in a way that will be relevant for different circles, for different audiences. So if you can work with us on that, we'd love to have your feedback. Next slide, please. So this is a toolkit. If you go to homeiswhereitallstarts.org, you can download this toolkit. If you email me, I'd be happy to send it to you directly as well. But this contains different samples, and in the next few slides, I'll go through what some of those samples include. Next slide, please. So there we go. CTAs are calls to action. We have calls to action for folks. It's at this point, because the campaign is just launching, the calls to action are very much focused around, hey, sign up to become part of this network, download the toolkit, share the toolkit. It's just kind of helping us to get this campaign off the ground. We do have a lot of different sample materials on there. You're encouraged to use those samples and also to modify them, to adapt them, because your audience is the best. So if you can help kind of message that and really tailor that for your groups, then we can help to get the message across in a relevant way and in a way that will resonate with folks. Next slide, please. So in terms of the kinds of samples that we do have an introductory letter so that you can introduce this campaign to your constituents and that you can help them to engage in this effort in a meaningful way. Next slide, please. These are the examples that I shared earlier: affordable rents and mortgages, homes that meet our needs. And homes that meet our needs is, can be defined pretty broadly. Yes, it is financial. It's also physical. It's location. It's helping people to feel safe and really to feel at home, and then homes within reach as well. Next slide, please. So we do have web copy that you can put right on your website. You can adapt it. You can use it as is. It can be copy and paste, as simple as that, or it's a starting place for you to consider how you might promote this campaign. Next slide, please. We'd love for you to send out any kind of communication to your constituents, to your circles of influence. There are a few different sample emails that you can use to let them know about the campaign, to ask them to join in on the campaign, and then to take action. And then it also has some really good information, just kind of in general about how to develop the best kinds of emails, the ones that get opened, the ones that get read, the ones that are responded to. So, I mean, if nothing else, it's just some really good tips and pointers about emails as well as social media. Next slide, please. And here's his social media. So you have those best practices for your own social media posts. For me, I asked my 13-year-old, she's an expert. But if you don't have access to a 13-year-old, there's some great tips right here in this toolkit, as well as some sample social media posts. And we'll be continuing to iteratively build this toolkit. So as we get more photographs, for example, as we get more stories, as we get more materials, develop more materials, we'll be adding to this. So please do come back to the website early and often for those updates. Next slide, please. And then the digital ads and flyers, we have a few samples on there, but it's really just to give you an idea of how you might message this. Again, you might have a very specific target demographic in mind. And these samples can help you to build your message around the campaign using the language, portraying the images. And there's some specific information in there about the kinds of images, colors, things like that. Next slide, please. And then the toolkit. If you go to homeiswhereitallstarts.org, you can download the toolkit. We do have some other material on there, and we'll be continuing to add to that website and look forward to any feedback that you might have. Say, for example, if you're looking for this tool and it's not on there, let me know, because we definitely want that kind of feedback in mind. And I think that's our last slide. And there you go. You are always more than welcome to reach out to me or anyone on MAC staff, but you can also email us at info@homeiswhereitallstarts.org. That gives a number of people kind of access to your request right away, so we can be more responsive. I believe that is the last slide. Yes. Okay.
This toolkit was also included in your packet.
Thank you. That is very handy. Any questions, any feedback?
This is Michael Hughes. I was just very, very impressive. How long is the campaign funded for or scheduled for?
We are building that as we speak. So the $105,000 will be for regional media buys specifically in this county, in this part of the state. It's actually a statewide campaign. So Home is Where It All Starts. They are out raising funds to help with the media buys outside of this effort. We do have the campaign funded right now in terms of the project management, the consultant assistance, things like that for at least a year. But the intention is to continue this year after year. Thank you. Thanks.
Amy, I know you guys have done a lot of work on this, so congratulations for getting this far. One thing that had occurred to me, well, actually two things.
Yes.
One is, I know this is really geared more towards permanent housing for people to call, for everybody to call something home. But when it comes to, and I know we have this connection between you're homeless and then you have a home. I'm wondering if the campaign can think about ways and messages that we can use for homelessness and temporary housing, because it is this continuum of housing that happens, and we have to start somewhere in order to get to a place where everybody has a place to call home.
Yes.
And so I'm wondering if you guys could think about that as you go through some additional iterations.
Yes.
And then the only other thing that I think it would be really helpful, and this is just something that I come up against all the time, is what is affordable. And that's a very complicated answer depending on the household income, et cetera, et cetera. But I think if we could come up with ranges of housing, like of what we're talking about when we're saying affordable, I think people can, relate more to that if we're talking about, a $350,000 home that costs someone $1,500 a month, or from $1,200 to $1,500, whatever it is that helps people sort of understand what we're talking about, I think would be helpful.
Yes,
in this regard.
absolutely. No, thank you very much. In terms of your first point about kind of building in an element around homelessness into this campaign, yes, absolutely. In Pathways Home, the campaign is positioned as affordable housing and homelessness. We started with affordable housing, but with every intention of moving into addressing homelessness as well. So absolutely, I'm still very much on the radar and in the plan. In terms of the second point, yeah, absolutely. It's tough to define affordable housing because it does depend on not just the cost of the housing, but also the level of income for that household. And people have asked us, well, how many units do we need? And we just say a lot. And there are some entities who have given a number, which for some specific communities or for some partners, they have been able to develop a number. But for us, from MAC's perspective, we haven't issued or we haven't calculated a number because of those complexities. What we've been using kind of as a proxy to that, particularly as we present this, is looking at the number of rents below $1,000 a month and then home sales at $300,000 or less. And that's not a definition that's universal for folks, because even $300,000 a month would be a reach for a lot of families, but it's a proxy that we can use. So for example, when we give presentations like this in specific communities, we'll illustrate regionally and then also for that community what percentage of rents they've lost under $1,000. And so, for example, I was presenting just last week in a community, and they had lost 95% of the rents below $1,000 a month since 2010, 2011. And so, as a region, we've lost about 86%. For rental units at $1,000 or less, and regionally, we've lost 75% of our home sales at $300,000 less or less since 2011 or so. So it gives us at least a starting place for that discussion and helps to make it a little bit more concrete. But you're right, there are a lot of complexities around, well, how much money are they earning and where do they live and what's the housing stock there like? So it is a complex issue, but you're right, the more that we can boil this down to something concrete, the more that people will be able to relate. Thanks. Any other questions, comments, feedback?
I just want to say thank you for the presentation. I think it's an excellent resource, and thank you for providing contact information, who to reach out to
Yes.
if there are any additional questions or narratives.
Excellent. Thank you very much. Thanks.
All right. Next agenda item up, we'll turn it over to Rachel Milne to discuss the encampments.
Thank you so much. Just wanted to talk a little bit about what the City of Phoenix and our partners have been doing around the Human Services campus lately. We made a big change in the way we were addressing the encampments around the campus a few months ago, in that we started closing blocks to camping after an engagement effort. And really that was due to our court order that we started that effort, but really wanted to talk a little bit about everything we've done regardless of that court order, sort of before that, and the changes we've made since that court order came down. So in partnership with the Human Services Campus and CBI, our two main really outreach partners around the campus, we've conducted now 8 engagement efforts around the campus since December of 2022. And when I say engagement efforts, it really involves shutting down a street, treating that one street and everyone on it as its own sort of encampment, and focusing efforts for those people on that street, targeting those efforts on that particular day. So helping people gather up all of their belongings, helping them, offering them an indoor place to go, multiple indoor places to go, the ones that would fit their needs the best, and making sure that we had indoor resources for every single individual on a given block. So as I mentioned, we've done 8 of those since December of 2022, and then 3 since May 10th, where we've once those efforts are completed, we've shut that block down to camping. So in those last 3 efforts, they were May 10th, May 31st, and then just last Wednesday, that June 21st, I think. We've worked with 121 individuals. So folks from the city of Phoenix, our team, Scott Hall's team, Human Services Campus and CBI, all out there coordinating for the day of to help people pack up. And I'm excited to say of those 121, 96 have accepted and have gone to an indoor place, be it a different shelter option available or a treatment option or diversion. So over 79% success rate in our mind. And I just really wanted to talk a little bit about how that happens. And it is a huge coordinated effort. I mentioned the campus and CBI as our main outreach partners in this. However, we've been partnering and coordinating to make sure we had those indoor options on those day of efforts. So we're coordinating with partners all over the county. So a huge thank you to all of the partners that have worked with us. Maricopa County has offered shelter, Native American Connections, CAS, UMOM, a New Leaf. Folks are down on site with us on those day of efforts and actually transporting folks right away when they are wanting to go someplace indoors. So we're extremely happy with the way things have gone. We have opened specifically for these efforts. We opened a new shelter last month, a 50-bed shelter. We've got another one coming on board next week. But my concern, and the city's really planning right now, for those 25 people who weren't ready to go to an indoor place and who ended up moving maybe someplace else where camping was still allowable within the campus. So that's what we're working on now, is making sure we've got not just shelter options, not just treatment options, but other options for folks as we continue on in this effort to help everyone around the campus. So that's what we're up to at the city. And just really quick, I know everyone in this room I've talked to probably about this effort, and just wanted to thank you. Literally, we've been at the city overwhelmed with the number of nonprofits and government entities that have reached out to really say, hey, how can we help? How can we be a part of this? We know it's a City of Phoenix court order, but this is a regional effort, and we're just so thankful for all of your assistance. But
Rachel, I have a question. The 121. So what was the total number is around? Is it 900? How many people down in the zone?
So the Human Services Campus does a weekly count. They do sort of what we consider the area around the campus, and then an expanded count that goes sort of past what we would consider the area around the campus. And I believe their last count was around 900. Yes.
And of the 121 and the 97 or whatever that were able to find shelter, with 121, what number of the 900 has it been decreased by? In other words, I know, by the way, I know how hard and how valiant this effort is, but I'm just kind of curious, is it, or as you're finding spots for these individuals, or just more people coming in to replace those?
So yes, we get the Human Service Campus weekly count, and it's fluctuated from, we thought we were seeing some real progress and 700, but then last week back up to 900, even despite our efforts around those 3 blocks where we know we've helped around 100 people move into shelter. So we're not doing a great job of helping the inflow of folks, I think, around the campus.
I just, for whatever it's worth, I don't know if it's fair to say we're not doing enough versus it just highlights the problem and the challenge that is faced by the city right now. So.
Thank you, Rachel.
Rachel,
Any
I have a
further
question.
questions?
May I ask a question? Okay. So you had mentioned the 50 beds that are opened, and then another shelter opening next week. Are the 50 beds that have been opened already being utilized? And then what does the other shelter look like?
Sure. Yes. So we opened that shelter in partnership with St. Vincent de Paul at the beginning of June, and they are all 100% occupied at this point. And what we did is we rented a small hotel, but we actually moved people from the Washington Street shelter, which is a congregate shelter. We moved folks from there into that hotel, freeing up spaces at the Washington shelter specifically for this effort. And that's really the will be the plan for the shelter we're opening next week as well. That one's another smaller hotel. Mercy House is operating that for the city.
And how many beds is that other one?
50.
Thanks.
All right, thank you very much.
I actually wanted, I just need to just ask real quick. Michael made a point of saying, you know, about maybe we're not doing, what I want to find out is how much, what's the precipitator of why are we keep getting, right? We know it's a broken system. It's not the city's responsibility per se. It's the system that unfortunately is not supporting the most vulnerable before they hit the street. And we're seeing, obviously, this time of year, it's really hard to address a lot of those needs where typically in the winter, people will stay in their home or in their cars, they'll find other places, right? In the summer, it's much more difficult to stay in your car. So I think there's a lot of data that could be gleaned from this constant inflow that can point at other ways that we can address and hopefully help to stem the inflow while we are also addressing the current need. So I want to be careful not to say, you know what I mean? Like for me, that a lot isn't, what's unfortunate is we're still seeing this vulnerability and it's growing. That's where I'm going.
Yes.
Okay.
Do we have any additional information on the inflow, on what we're seeing?
Don't want to
Okay.
jump ahead too far, but gaps analysis is
Okay.
coming in item 9 today.
All right, we'll hold off until we get to that
Can
piece.
I just make a comment to what's being said? I think it's really important. I stepped away from homelessness a few years ago and I came back and I oversee an emergency shelter. And we've had some folks that have came from the zone, and I really am highly impressed with the amount of engagement and support services that our community has really grown tremendously with. So for example, folks that are, you know, substance users and maybe they are not ready to stop. There's been a lot of efforts to have different like outreach communities come in and do interventions with these folks, you know, try and offer like treatments. And sometimes folks are just not ready and they just go back to the streets. And so I remember, you know, years ago when it wasn't that comprehensive, we didn't have all that support. And so I hear, you know, how are these folks getting back or what are we doing as a system? I'd be curious to know if some of these folks that are returning for a certain reason, you know, if it's SMI or, you know, and I think like Katie said, gaps analysis is coming. But I think, you know, just we've done a lot, in my opinion, as a community, and the frontline workers, we just wouldn't be able to make it without them. So thank you and everybody else that's a provider here. So
Thank you for that great feedback. I think it's always interesting to hear, you know, when you're in the middle of it, you can't always see it. And so for someone who steps away and comes back to be able to offer that perspective is nice. Thank you. All right.
Then I just have one more question.
Oh, okay.
So once that block is cleared, what is the plan to keep that block cleared? What does that look like?
So the 3 blocks we've done where there have been individuals, we've also closed several other blocks where there weren't individuals camping. We've posted essentially like a no camping sign on each of those. And we haven't had any issues. We haven't had to involve any sort of enforcement on any of those so far. They've all been respected, which was actually a big relief. We weren't sure how that was going to go, but we're very thankful that, yes, people have respected the no closure signs, or sorry, no camping signs.
But Rachel, correct me if I'm wrong. If people were to return and camp there, that would, because there are signs posted at that point, enforcement could happen.
It is illegal to camp on those blocks, yes.
Thank you. Amy Schwabenlunder, Human Services Campus. First, Rachel and Scott, City of Phoenix have been amazing communicators about what they're doing, very open to feedback from partners involved. I would make an ask that people in our work not refer to our neighborhood as the zone. People started calling that to be derogatory. It's not meant to be positive and support the people that we serve or people experiencing homelessness. You can call it a downtown neighborhood or the neighborhood around the Human Services Campus if you like. Just a suggestion. And prevention for me is critical. We don't have the inflow conversation often enough around how do we prevent and stop the cycle of people coming into unsheltered homelessness. And unfortunately, over the years, the neighborhood around the Human Services Campus has become a safe place for people to be because they were not told to leave or asked to leave. And here we have this long-term repercussion that does impact everyone. And I thought I had something else, but I forgot. So thank you. That's all.
Thank you, Amy.
Can I just add? Yes, thank you, Amy. We at the city, we try to make sure we educate people on not using that term all the time. So thanks for saying that.
Rachel, one last question, and you may have covered this, and so I apologize if you're going to be repeating yourself, but making that area illegal to camp from here on out, what mechanism did you guys use to make that illegal?
So just the way we would say on the canals, when the canals close to camp, that the area is just not you're not allowed to camp in that area. So we're publicly posting that area is closed to camping.
Okay.
Essentially.
Thank you.
All right. Moving on to the next item, we'll be talking about performance standards. Dylan Belmont, Human Service Planner with MAG, is here to provide an update on the standards.
Thank you, Co-Chair. Okay, I'm sharing my screen right now of the most recent version of the performance standards. I know this is something that has come before you in the past, but since then it's gone through almost every committee here in the COC to gather additional feedback and see where it can improve. Just for some additional context, this tool is something intended for providers to be able to better contextualize their performance compared to the system. We talk a lot about system performance measures and other ways that providers are, serving their clients, and we don't really have much in the way of how can we impact these really broad system performance measures, right? So this tool is a starting place for us to be able to see that. Essentially, what will become of this as soon as, if this is approved, it'll be posted on the MAG website, publicly available for providers. And then with support from HMIS and the Solari team, providers will be able to pull their own report, matching all of these different metrics to see sort of where it stacks up. Solari is also going to be producing some training videos, so it should be a very streamlined process of, learning how to pull this report as well as comparing it against the performance standards that have been created here. As a reminder, there are both standards for singles and family providers. So a few differences with the program types and also the eligible criteria. And then just to make sure there are no stones left unturned, there are 3 pages of pretty detailed definitions that further explain, what data elements are being pulled into these criteria, how the standards were formulated in the first place, and then any relevant links to, help inform what these numbers are and what they mean. So that's mostly it. There is an additional next step to come from this. Solari is also working on a sort of visualization of performance standards, of performance of the entire system for these criteria on a more, a rolling basis, so you can see the trends over time. And hopefully with this information, we can, highlight these points, areas of opportunity and grow as a system. So with that, happy to take any questions.
I have a question. Or more of a statement. Thank you so much for this, Dylan. This is fantastic. I think it's so important that we have, measurable goals that we're all striving towards. They don't quite align with our system performance measures right now. So I would ask that we take it back to the committee. For instance, on returns to homelessness, our goal is 13% as a system. And even if we take the average of the programs that impact that score, we don't get to the 13%. So I think if we're not, currently scoring programs using these standards and really holding them to it, I would say financially with their awards, if we could try to get them to align more with us meeting system performance measures, I think that'd be great. The other one to look at is the positive exit destinations. If we look at it across the system too, we need to get to an average of 45% positive exit destinations, but we don't get there with the programs that would impact that. So if we could look at that. And the last thing to mention is just the average length of stay. It seems like they're using just their current data to try to get to that, but you could have some individuals who come in and just leave within a day that would skew that number. And our system performance measure, I think, is 97 days. So I would have kind of opened it up for thoughts around having them actually potentially increase their average length of stay goals so that we could more positively impact all of the other areas. If you're not trying to move somebody out as quickly as possible, can you make sure that they're moving to a place that they're not going to return to homelessness afterwards, or spend a little bit more time with them on their income while they're there? So again, just fantastic job for putting this together, but just a couple things I'd like for us to get back to the committee.
Yeah, thank you so much for those comments, Liz. I think it's a really good point. As for what these performance standards sort of indicate, they were built on a framework of taking how the system is more or less already performing, right? Taking average system performance for all of these different criteria and using it as a jumping off point or a baseline. I think the intention with these initial standards are sort of to, build the area where providers become comfortable with seeing their data in this context. So then down the line, it could be revised into, potentially more, higher standards or something that's more of a goal to reach. But yeah, definitely in line, I think, with the overall intent of your comments and this project. I think those are aligned.
Thank you for that. The only other thing I would suggest then, is they really, I came from a provider, so I get being cautious, but also I think we know our system performance measures too, and what those goals are, they're on the website. So if we even just added a column to this so they could really understand, what is the true goal they're trying to strive towards, it would just be the system performance measure is 13% or something like that. That'd be my suggestion.
Yeah, that'd definitely be possible to sort of add that link back to the system performance measures.
Liz, can I add two things to this? One, this was all also based off of the federal fiscal year, which is in line with our system performance measures that we submit to HUD. So anticipate this fall, they are going to come back to you once providers are comfortable pulling these reports with updated performance standards. And then accompanying this document is going to be a performance goals document. So maybe the standard is 60 days, the goal would be 50 days, for example. Or the positive exit destination standard is 40%. That's what we want everybody shooting for, but a goal is 50%. So we're really striving to push folks towards that goal, but knowing that the standard is more kind of expectation of what we're putting into play in the community.
It sounds great. Yeah. Again, thank you all so much for your work on this. It's really good.
Thank you very much. Any further questions?
My brain is going fast and I have a million questions and I want to be concise and I don't want to seem stupid. So I'm just putting all that out there. What is this is voting on today, right? So if we vote yes, we want to put this in place, what's the impact? What does it mean to people? to providers?
Sure, that's
Just
great.
means you're going to enter their stuff in here and there's nothing there, that's it, or?
So yeah, essentially, if this is approved, this will make these performance standards essentially effective. I'm not sure if there's, what's the word, like enforcement, so to speak, but really just providing this tool as you know, a way to inform, right? And so it would set the process in motion to get those provider reports, that template going, so
Okay.
it can be pulled, and then as well as the framework for the visualization of it.
So just for my clarity, on the first line, those are numbers that are calculated. They're not so they're going to enter whatever's actual for them. This standard shows us what they're doing, not the goal as Katie just talked about, right?
Correct. Yeah.
Okay.
So
Okay, that's good. That makes sense. You can keep talking, but I'm starting to fall into place because I'm having a panic about some things up here. And so before you say anything, where my brain is, funders also use stuff like this to write in restrictions on how long somebody can keep somebody in rapid rehousing. And I think that some of the negative exits come because we aren't housing people long enough. So when I see those dates, I'm thinking, oh, like, what's the education we have then around this so that it's not incorporated by someplace I used to work or someplace that I might work in the future, or, you know, I don't know, I win the lottery tomorrow and set up some foundation and I'm saying I'm only funding rapid rehousing programs that are, you know, at this certain date or whatever that is, and a million other possible unintended consequences.
right.
That makes sense.
Yeah, no, most definitely. So hopefully the definitions pages do further explain both the intent of this document and how it can be used. But exactly as you said, most of these criteria, they're either you know, from the community adopted best practices, or they come from system-wide averages of that federal fiscal year. So from here, you know, this document would be made available. A provider would pull their report of their like current information, and then they could compare it against the standards to see if they're performing higher in this area, lower in this area. You know, what is the standard for returns to homelessness, and are they meeting the rest of the system, or is there additional work to be done, or, you know, is it an outlier? Or
So these will be fixed though at these numbers. They won't be changing when they enter their monthly data. Is that what, like this, we're saying
These numbers are fixed from October 1 through September 30th, 2022. That's how the system performed on average from
okay.
2021 through 2022. So we anticipate that these standards may change year over year, but not like day to day or month over month, depending on how the system is performing. So for example, if length of time to housing placement, if everybody in our system is doing worse because we have a really tight housing market, is it fair to still hold them to a 106-day standard? Probably not. But if we have just one outlier who's taking 300 days to house somebody and everybody else is at 105, then we should be doing some cross-learning and technical assistance to how to get that one provider who's at 300 days down to meet the rest of our system.
Okay. It's how it's currently performed. I just want to make sure I understand before I make this next statement. This is about how it's currently performing. These are fixed numbers. They're going to be able to, providers will be able to compare their number to whatever it is on whatever activity they have going here, right? It's going to be 12 months long, and it's based off of the current performance across the system for a period of time, right?
So these standards are October 1 through September
Right.
30th. The visualization that Dylan was talking about is going to be tracking on an ongoing
Okay.
basis.
Okay.
So the standards won't change, but the tracking will continue to change. So for example, like
Got it.
if you're pulling your shelter comparatively to other shelters for the month of May, you'll be able to see what the difference is in the current state of mind. But these standards are just a 1 year.
Okay. Yes, so I think I'm just hung up on the word standard, because to me, the standard is almost like there's a crossover with the goal. And when I'm looking at this, so this is what we're currently doing, but is what we're currently doing working? Like, and now we're measuring towards something that I'm not sure we all agree is actually working. But I also get that we have to start someplace and we have until October, but I don't want this to just be something, I'm not in a place where I'm gonna just rubber stamp and say, yep, here, this is a new something that we're gonna do, if we're not gonna really look at how this is all interplaying, because system like interplays, right? And that we're clear on that. I'm not gonna say if that makes sense anymore. I'm just gonna assume that if it doesn't, you're gonna tell me, and that'll be that. Okay.
I think just to add to that, Cricket, we hope that this is like an ongoing process, and that these do come back to the board time and time again with updated numbers. And if we need to change the criteria, it's flexible, and we want it to remain helpful to providers, and that we actually see a difference in the system performance measures. So definitely want to remain open throughout the coming years.
I appreciate the work on it. I think it's important work, and I think it's we have to commit to staying on it, because we can't just be like, this is what is, and then it's not what is anymore, or even what should be maybe. So I do appreciate, and I think this is a good step forward, so.
Just
All
a
right.
real quick question, along with, because numbers can only speak to one piece of this. So the narrative up or down each month is going to be super important. I think and I guess I'm the person who always speaks for the older adults in the room, but because I'm becoming one. But I think as we're seeing the increase in older adults getting into homelessness, and their ability to earn, and that whole idea of how do we keep them in housing and the vouchers and all of the fun things, the narratives are going to be really important for us to be able to track back and be able to know what part of the system is not working to create a positive piece, right? So looking at that and how do we adjust then, I think will give me more ability to then go, yay, it's working, or where are we not? So thanks.
And I got to jump in again because I'm concerned. I get being flexible because this is new. I do think we're being a little bit too flexible, and we might get people in a position where they think that's like the program is operating at a positive standard when really it's pretty far from it. So I do suggest we take it back. We have them take it back before we vote on it and try to get it to where their averages align with our system performance measures. One thing to note, like on the bridge, ES bridge, is that we're saying that they'll have a 25% exit to positive housing, but then a 34% returns to homelessness. So they would have more people returning to homelessness than they even exited to positive housing. So as I said, I think we needed to have it sent back to them and try to get it to align more closely with our system performance measures.
I was actually going to support that idea too, Liz, and then ask, I kind of liked your original idea that we add in the system performance measures into it. Do you think, Dylan, that would be something that the committee might be willing to do?
Yeah, I don't see why not. Aside from the 8.5 by 11 page being pretty cluttered already. But the end goal is always to sort of align it with system performance measures, right? So even more clarity on which criteria associate with those, I think might be helpful. Yeah.
And with that, I would suggest too that they look at that average length of stay, because if we say this is a performance standard you're striving towards, and an emergency shelter, a traditional shelter, is not meeting the 28 days, but they're getting more positive exits, then that's beneficial. So they really should look at maybe potentially increasing their performance standards for average length of stay.
And going back to the whole piece of narrative where that does come into play, providing that narrative to us so we understand. So when, or HUD understands, or someone understands why that was, I mean, going back to Liz's piece about the 34%, delta there, why did we choose that? Why was that where that group decided to leave those, if they do decide to leave those and not align them with the performance standards? Why? Right? So that way we have a defensible story behind it.
And I'm going to just add on to, I agree with some of the comments that you guys were talking about with the performance mentor standards and measures. But the other thing that I think could be really helpful, Dylan, is once we've gotten this into a form and a function that feels really good, is to almost turn it into a newsletter with this being embedded within it. Because that way you can basically tell people why to care about this information and what it's telling us about our system. So that we're able to talk about it and frame what's happening versus just letting people read the raw data and misinterpret it.
Yeah, both super helpful to hear. I think definitely a lot of opportunity to further explain the narrative and why this matters.
Amy Schwab and Leonard Human Services Campus. So I thought I understood what this was as it was being developed and hearing updates, and now I'm feeling confused. So it sounds like maybe it's not standards, it's a benchmark or a baseline of averages of over some amount of time. So to the conversation, it's sharing information. These were the averages over some amount of time for these interventions, and I can't read the left-hand column. Because I heard someone say this is not goals. This is not system performance measures. Those numbers are all important because I'm sitting here as a provider of emergency shelter and bridge housing that's not funded through the continuum of care process. So wondering, how am I supposed to use this? Which I'd love to find a way. So now if it's a baseline and we could use this to measure our performance against it to say, did we do better than this benchmark? And then as a system, the COC is sharing, I don't know, quarterly or some regularity. Did the baseline change? Or this was the snapshot of whatever 12 months you said. Here's the last quarter and then the next quarter, and we're starting to look at trends. Is anything actually changing? And the narrative is trying to understand why something changed or not. And the goals sit in a different place. Maybe.
Yes.
I don't know if that was a question or a comment. I'm just trying to think about how to apply it in the day-to-day work.
I think some other further narrative to say in this, COC doesn't fund any. We fund a very small fraction of what is up here. So this is also working with other funders to say, other funders, how are you incorporating these targets into your contracts? So been having the same conversations with funders as we are having these conversations within the COC realm. But yes, to the point of, I think we're getting a little into semantics of language, but benchmark. Right now it's averages with the hope of saying that as these increase, standards will increase. And to Liz's point of, are we setting our standard too low to begin with? And that really we should be striving for higher. But transparently, up until this point, a lot of providers have not pulled these different metrics ever, or even in the last 12 months. And so now all of these reports are built out in SAPO, and HMIS is rolling out a series of trainings of how to pull these reports on an ongoing basis so that folks can even know, I have a 10% return to homelessness, or I have a 40% return. Folks don't know that at this point. And so setting this as kind of that standard to start, so you can say, this is how the system average is doing, this is how I'm doing as a provider, and doing that comparison, but realizing that we have a long way to go if we want our system to be performing at a high level. And this isn't that right now, but we got to start where we're at right now.
Thanks, Katie. That was really helpful for for me because I also feel dumb asking questions about it. But and it's been brought to ESG like several times. So thank you. But I will say like what I took out of it and what we went forward with in our upcoming contracts for this year is we're listing like if we have a emergency shelter bridge, we're listing all of those as indicators in our contracts. Like those are things that people are going to be reporting on to us on monthly basis is all those indicators. So we can measure where we are with this benchmark data and then with, compared to our other contractors, honestly. So.
Yeah. How wedded are we to standard? I think that where it needs to go completely because it's very misleading and call it what it is, an average or benchmark or whatever. And then obviously you want goals for targets. And then, so I think that would solve a lot.
Hi, Michael Sim, The Logical Foundation. I was wondering, apart from just these numbers, which are talking about returns to homelessness and the time durations, is the amount of money spent per person on each different intervention and the amount of money spent over time per person recorded in here or in a different location? And where can that be tracked to get the true like cost per impact if you're trying to measure that?
Yeah, sure. Thanks for your question. Oh, do you have a? Okay. Yeah, so I guess a few things with that. First of all, thank you for the suggestion. It wasn't something that was brought up in any of the other committees when it was presented. I think one of the challenges with pulling it might be that this data isn't always available in HMIS. We want these baselines to have a sort of consistent framework to pull from. So there were some other criteria that we maybe wanted to add there, but were just difficult to get standardized. And with that, it might be difficult to have that as an average if we don't have that information. But I think definitely open to considering additional criteria in the future if there is a way to do so.
And then I'll just add from my perspective, that's something we look at on a contract by contract basis, certainly depending on the type of contract that we have, how much, bang for the buck. Sure.
Great, thank you, Dylan. All right, at this time, we have a motion or we'd like to motion to approve the standards. So do we have a motion?
Madam Chair, I move that we send it back to the COC committee for a little bit more work and then take a look at it maybe at a future meeting.
I second that motion.
Take a vote on the motion. Okay, then I would like to take a vote on the motion. All in favor?
Aye.
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 All opposed?
Liz, can I have your vote on that motion to send back to the committee?
Aye, thank you.
Thank you. The motion passes unanimously.
Madam Chair, can we be shared the date they're going to be discussing? I would love to listen in on that.
Okay, perfect.
July 12th.
Thank you.
All right, the standards will be posted on the website in the upcoming weeks. There will be a training rolled out in a learning management system on how to pull the reports out of HMIS and visualization of the community standards. With that, we'll move to the next agenda item. All right, next up is Katie to discuss the charter review.
Michael Hughes, going back to Chris's comment about the standards, are we going to work on changing that terminology? Or is that?
Yes, I heard the word of benchmarks. Did people like the word benchmark?
Isn't that-
If it's an average, I didn't know if the criteria column is actually the standard measure we're trying to get to versus the title is the average. But
So some are
the
benchmarks
number
and
is an
some are
average.
averages. They're not consistent. And the definitions page really goes into whether or not it is an average or a benchmark. Some of them are from the community adopted best practices. Dylan, I'm looking at you. That's right.
Yeah, I guess that is. So like the naming itself, this project took a few turns, I think, as it was getting developed and seeing where our community was like currently at versus what the project intended to do. So yeah, I guess that is a little tricky. The vast majority of them are system averages from HMIS, but some of those criteria can't be measured through that. And so they were deemed, either by the board or by other committees as important for inclusion as criteria. So those standards were pulled from other sources, either the HMIS data quality policy, for example, or the community adopted best practices. So yeah, I guess that's.
Can I
if
add
may,
also?
I think whatever you come up with, that's fine. Go back and work on it. I think it was more just to your point, Chris, the terminology of standards really throws me off. Yeah. Okay, thank you.
All right, I'm moving us on to charter revisions. So gonna go through some of the changes made to the charter, gonna call on the charter work group to provide any additional changes or narrative context to the work done. Across the entire charter, we standardized meeting language, membership language, and co-chair language. The track changes was attached to your board invite. So it looked like a lot of red, but it was really just standardization across all of those different to make sure that they all said the same thing. We changed the code of conduct to be on file rather than annually. You all are only sitting on the board for 3 years. We do follow up with you to see if anything changed, but having you re-sign a piece of paper every single year did not feel like it made as much sense. And then we updated formatting and spacing just to stay consistent. The work group is recommending a change to the COC vision to be further in line with the Home is Where It All Starts campaign. So the black is what you all had before. Our vision is a region committed to anti-racism, free of discrimination, where all people have a safe place to call home. And they recommend adding this language of that supports their health, well-being, and livelihood. Right, no one's screaming, so I'm gonna move forward. The next recommendation was changing the top value from nimble to responsive. They felt like nimble wasn't actually what we do with really high government funding. And so changing it to we challenge the status quo and seize opportunities for innovation rather than nimble. They felt like it really responsive more embodied the work that you all do. All right, I'm gonna keep going. COC board, you added one representative of a youth homeless representative to the board. This is really in response to the Youth Action Committee and applying for the Youth Homelessness Demonstration Project, but also in recommendation from conversations with you all. This individual would be youth, so 18 to 24, either currently or formerly experiencing homelessness.
So are we set up to support their involvement with our current structure the way that we are?
We hope so and do anticipate that staff will help ease that transition as well. We currently have a youth action committee that Haley has been supporting. They are paid for their time to be here. We do anticipate that there will be kind of some onboarding that will happen. We are really trying to break some of the formality of your current structure and really having it be an open space where they would be able to participate in the same amount of dialogue.
Also, if any of you are interested in helping shepherd through this process, I know it's a little bit new. Vicky came to our Youth Action Committee last week. I guess it was just last week. Feels like a long time. And was able to explain a little bit about what the board does and help set those expectations. So I will say, as you all have been new members before, appreciate your patience as they're onboarding. And if you would like to assist in that onboarding, I would love your help. So thank you.
The other responsibility that you all added was provide critical informed feedback to the greater context on the impact of policies, procedures, and efforts to prevent and end homelessness. This was really a thought process of having critical discussion and really feedback to kind of moving away from just approving things and really being active dialogue participants like you all did today. Group, anything to add? I'm going to now go through each of the different committees that recommended language to the board work group and that the board work group accepted. Averaging in the ESG committee, adding the leverage shared learning and standardization to improve implementation of ESG locally, and removing any references to the year of the NOFO. That was specifically in ESG, but not other sections of the NOFO. All right. Local Jurisdiction Committee changed their introduction. This went away from providing input and recommendations to the COC and expanding on perspective of local government, supporting cross-jurisdictional learning of best practices and problem solving, and serving as a platform for coordinating services to end homelessness. Right. As I just mentioned, we added a Youth Action Committee. This is your ninth lateral committee underneath the board. They have been in a committee since November was their first meeting, but had not officially been brought into your charter. So this added language, they approved their charter and helped write their charter, includes kind of all the other sections of the charter similarly: meetings, participation, code of conduct, membership structure, selection, co-chairs, and roles and responsibilities. It is for 18 to 24 only. They have to be in that age range. They can stay on until they turn 25, but at the point that they turn 25, they can no longer be a paid member of that committee. And we're really recommending that they transition to other committees such as lived experience or other committees within the continuum of care. All right. The last thing we did was really add language around the grantees. So working with both the coordinated entry leads and the HMIS grantee to add language about what their detailed role is. Prior to this, the charter just basically said, run coordinated entry or run HMIS. And so this added a bunch more steps really outlining what is their roles and responsibilities. We worked with both the coordinated entry leads and the HMIS grantee to build out this language and incorporate the MOUs that we have in place with both of them. We also work to ensure that there's consistency between those two. So for example, if one said work with HMIS on this, the other one said work with coordinated entry on that. Any questions? This all was included in your packet and made beautiful by Dylan Belmont.
May I ask who was on that committee? They did an excellent job.
It was Cricket, Jessica, and Lisa Glow.
Kudos. Very nice.
Thank you, Katie. Are there any additions that the charter work group would like to add?
Katie, thank you for being very patient in those meetings with all of the technology and different levels of understanding about what we were doing and why we were doing it and how it was happening. You were a star, so thank you.
All right, any further comments or discussion from the board? All right, may I have a motion to approve the charters?
This is Chris, so moved.
May I have a second?
I second that motion.
Chris and Cricket. Thank you. Is there discussion of the motion from the board or comments from the public? All right, for those in the room, we will take a voice vote. Those in favor, please say yay.
Yay.
Yay. Those opposed, please say nay. Motion passes.
Liz DaCosta, can you please vote on that?
Yay, thank
Oh,
you.
sorry, Liz.
Okay, thank you. Yay.
Yeah.
Thank you to the Charter Work Group and all of the committees for your review of the charter over the past month. Next, we'll be moving on to the next agenda item on gaps analysis. Katie will provide an overview of the gaps analysis, which was completed over the past quarters.
All right. So the full gaps analysis was included in your packet, but gonna walk you through kind of a brief overview of what is included in the gaps analysis and some next steps. So an overview of the gaps analysis, it walks through current efforts, including plans and strategies, projects, and meetings and groups. Gaps identified, we did both stakeholder and focus groups. And then looking at our data, which at this point, I hope you all are comfortable with looking at how much data we've reviewed. So current efforts, we have 39 total plans that operate in and around Maricopa County. So going to walk you through just kind of a brief overview of each. 1115 waiver. We have 3 state agency plans: Department of Health Services, Department of Veteran Services, and Department of Economic Security. The qualified allocation plan, which really looks at affordable housing development. 13 consolidated plans and 13 annual action plans, one for each of the jurisdictions that are required to write an annual action plan and consolidated plan. We have 2 additional local homelessness and housing plans, both at the city of Phoenix. We have 2 regional jurisdiction plans that is really looking at the local strategies and pathways home. 2 nonprofit regional plans, Value Sun United Way and Vitalist, and then 2 COC plans. So you have a race equity plan and the strategic plan, which I hope you all are familiar with. We also have quite a few projects that are identified and detailed in the gaps analysis, 12 in total, a bunch of data projects, learning projects, evaluations, both HMIS and coordinated entry, and then also connecting projects. So things like shared housing and connecting 211 with the Family Housing Hub with 211 and things like that. So really encourage you to go read about all of the different things happening in the community. Really excited to reduce duplication of efforts, specifically around projects in the community. And then lastly, I want to talk through meetings and groups, over 35, all public meetings that you all are welcome to attend. 25 of them are specifically around the COC. So you have the board meeting, 9 lateral committees, and 15 collaboratives and work groups currently meeting right now. We also have the Homeless to Housing Roundtable that ADOH hosts, 6 policy meetings. So those are really looking at the Interagency Council. The Arizona Community Foundation has an affordable housing collaborative, things like that, that are all detailed in the plan, as well as who organizes them. And then 3 plan and strategy meetings. So really, how do we accomplish those plans and strategies that are happening on the first slide that I showed you? Through the gaps analysis, we did identify several gaps, things that were going well, but also things that needed improvement. So going to run you through those. In both our focus groups and our stakeholder meetings, we found that there was once you were connected to services, it was easier to get connected to other services. So a lot of really good feedback, kind of what Jessica mentioned earlier, is we've done a really good job of, once you're engaged with the system, making sure you can get engaged with the rest of the systems that you are eligible for. Heard a lot of really good feedback about peer support models, ensuring that folks with lived experience or experience of mental health or substance use, and really engaging those folks to be successful in engaging other folks who are currently experiencing homelessness. And then to the last point, data and data sharing, we've done a much better job not only understanding our story, but telling our story in the form of data. But to that point, we have some areas for improvement. We heard kind of consistently, both from stakeholders and focus groups, we do not have enough resource in the community and we do not have enough housing. So those are 2 areas of focus that really need to increase the amount available. The other things we heard were more flexible services. So really understanding that we need to be able to adapt services to the needs of the individual when they are presenting, and a lack of clarity and coordination. So folks didn't necessarily understand where they were getting handed off to, or what did that look like. And so really understanding that we need to have that clear channel between the provider who's providing the services and the individual experiencing homelessness. Lack of training and support and better education and collaboration. Both of these were really in the space of, not only do we need better education, and hopefully the learning management system will begin to tackle that, issue, but also better education and collaboration with community members. So the community really needs to understand what's happening around homelessness, and we need to better educate them in the homelessness space. And then finally, a feedback loop. So both providers and people experiencing homelessness shared that we need a better feedback loop for them to share what they experienced and whether or not that they had a good experience or a poor experience, and how to provide kind of that grievance or feedback to the people who are providing that service. So Cleo on our team has been working on a grievance form for across the entire continuum of care to be able to direct that back to folks at the agency level, but also understanding that we need to make sure we're vocalizing back how were those grievances addressed to people experiencing homelessness. So I'm gonna walk into that data. We did kind of a deep dive into all of the different data that we have available in the community, but one of the biggest points is we have 21 people entering homelessness for every 10 leaving homelessness. So we have way more people coming in than going out within the 2022 year. So we know that there needs to be more to address how many people are coming in and making sure people are leaving at a faster rate, because we do not have enough folks leaving the system at the rate. This data point initially came to me. I was at a conference with San Diego, and San Diego said we had 13 coming in for every 10 going out. And I was like, I wonder what ours is. So we have way more people coming in, and part of that is our rental increases, but understanding that we need to address that inflow of new people to the system. Which goes to my next point of we have not enough affordable units, with less than 10% of units being less than $1,000. So we're continuing to see this decrease happen over time. In 2010, over 90% were $1,000 or less. Now it is less than 10%. So we're continuing to see rents rise. Unfortunately, more people, especially in Maricopa County, experiencing homelessness for the first time. So with that, I will pause. There is much more detail in the gaps analysis itself, but would like to have a brief conversation about where do you want to go next from here? And also, how does this impact the NOFO that will hopefully drop soon? And if you all have any changes in your prioritization specifically for that, which will come in your next month meeting. So more something to think about than a question to answer right now.
Katie, I was just wondering, how are we planning on using this information? Will it be on the website? Is this mainly just for us? Because if it's going to be somewhere published, it's going to provide a little bit of feedback. There's a slide, the data slide, right before the data slide. I don't know if you can go back to it. Lack of clarity and coordination. The slide before that says connection to services. It's going well. And then the one you were just on, going forward. Lack of clarity and coordination, but you said within the community, which was huge, because you're saying like we know how to connect people to services, and we internally as a system, when somebody enters the system, we know how to connect them with services, but the lack of clarity and coordination, can we just have like a clarifying word within the community? Because it kind of sounds like it contradicts a little.
Yeah, so I think the full gaps analysis will be published to our website. These slides will not be.
Okay.
I would say the biggest difference is on a case-by-case basis, people felt like, but as a system, it wasn't the case. So as a system, there was inconsistency about whether or not you got pushed from person to person. But I was offering services to Jess, and I got Jess connected to the next person and connected to the next person and the next person. But then if I compared what Jessica was offered with what Cricket was offered, it wasn't consistent, even though maybe you had the same services needed.
Oh, I see. Okay. That makes more sense. I thought it was more of that people are being connected once they're in the system, but then people within the community don't quite understand the coordination or have an idea of what that looks like.
That is also definitely true. The better education and collaboration is people do not from outside the system understand what's happening within the system. And they think that the community needs better education on what is happening within inside the system too.
Okay.
Thank you, Katie.
One thing that jumps out to me probably more than anything, I look at this committee, I look at all the collaborations, I look at all the effort that goes into everything that we're trying to do. And I look at this, the 21 entering for every 10 leaving. And there's such a misunderstanding with what I would call the people who, maybe the elected officials, that really want and don't understand to the degree that it's an epidemic. And there's such frustration from the funders thinking, for lack of a better way of saying this, what the hell's going on? What is going on here? And when you look at that statistic of, for every step you move forward, you're moving 2 backward. It's pretty sobering. And it's somehow for the people that feel not enough's being done, that they're not understanding the seriousness and the depth of the challenges before us. So that's just a comment, but that's very striking, Katie, when you said San Diego is 13 and 10 and ours is 21 and 10. And it's like, wow, that's sobering.
Well, and just to add to that, that's within the context of receiving all these funds and this new programming and everything that we have added from a resource and programmatic standpoint during the pandemic. And we're still 21 and 10. That's scary. Or 10 and 21.
This is something that was just brought up at the communications work group also. So they are looking to further refine the homelessness trends report information and bringing that kind of to the top of the talking points around the homelessness trends report, because that's where that data comes from. So those revisions will be happening by the end of this week. So do anticipate that that will start to become more of a talking point here locally.
Katie, I just have an additional question. Was there anything salient that differed from the last gaps analysis that we did as a system?
I would say, to be fair, none of the staff that was here did the gaps analysis. So, but I think for me, just hearing over and over again, even folks from stakeholders all the way down to people experiencing homelessness said the same thing was also pretty shocking to me. So they were saying this, people experiencing homelessness were saying the same thing of like, there's not enough resource, there's not enough housing. And kind of it was almost identical what was said in focus groups and what was said in stakeholder groups. And I don't know if we've experienced that like almost identically before.
Katie, was your question were you asking for direction from us as a group, what to do next? Is that what you said?
I want you all to start thinking about how is this going to impact your future decisions. So for example, next month, you're going to have to give prioritization to how you want to fund NOFO projects, hoping that this will impact the purpose of the gaps analysis. This is a required annual report from HUD each year that each COC does a gaps analysis, but for you to also identify from the gaps analysis, how does that influence your NOFO prioritization and also your strategic plan each year? Thank you.
Okay, any further comments from the public? All right. Thank you to the MAG team for your work on this and all of the individuals who participated in the gaps analysis. All right, next item up, we're going to be talking about the request for future agenda items. Does anyone have anything in addition that they would like to add?
I have one thought, and Liz, I apologize if this is catching you off guard. I was just thinking about it during the meeting, but the whole conversation about sober living homes, there's a lot of conversation that's happening at the local levels about these homes and how cities can respond when our community is concerned about them being in their neighborhoods. And, and from the city's perspective, we only have so many tools, but one of them is working with the state so that we can make absolutely certain that the homes that we might be getting complaints about are legitimate and licensed and quality services, so that we can say they're allowed to be there, and we can, keep that perspective as we go through our enforcement. And then likewise, when we don't have that, looking at our tools from an enforcement standpoint, and anything that the state has in addition to that. And so it might be an interesting conversation, if not at the next meeting, another meeting down the road, where we can just talk about the role of the state and the role of cities and how we're starting to connect and work more together. I know that in my city, there are some of those conversations that are already starting staff to staff. So my hope is in the next few weeks, there'll be more discussion about that at both levels, and figuring out how we're going to do that work together.
Yeah, I think it's important. And ADHS actually is the state agency that does the licensure for sober living homes. So if folks are interested, I can ask a representative to come and speak a little bit more to that licensure. There is language in there that does require homes that meet the specific rules, essentially, that they've listed in their licensure. They are required to become licensed as sober living homes. And I think there is definitely a gap there where some of them actually don't. And we could call that to the attention of ADHS if we need to. But as I said, if we think, Katie, we want to have ADHS here to talk about sober living homes in the future, I can ask.
Follow-up question. Is this a better conversation for local jurisdiction committee or for the board, given how many is this more of a jurisdictional issue?
Maybe it's at least starts there. That's a good idea.
I think it's good to start there, but I do think there's a matter of referrals out to the community to know what to do when you have these displaced individuals come into their system, because the state can be helpful on how to redirect them, because they're trying to do their best to house and not have too many displacements as a result of these non-certified homes.
If Andrew might be a good person to invite back to really talk about that screening process and what to do and the flow, so that
it sounds like two things. One is there, if there's currently a home in the city, how can we coordinate with the state? And that would be a conversation we can have with ADHS. And I think that local jurisdiction committee sounds fantastic. So just, if you want to connect me, Katie, then we can take care of that. The other, though, is what to do with individuals who are currently displaced due to access doing CAFs on providers. So there was concerns for credible allegations of fraud on outpatient providers. And so access is involved in that. And in order to address that, we do have the line set up with Solari. So if we have anything further on that, Andrew can come back and tell you exactly how that process works.
I do. I have something else I kind of want to add, but maybe we can just say no if it doesn't work. I've been thinking about so now that I'm not working where I used to work ever before, and I'm working with a housing provider, permanent supportive housing, I feel like it's all siloed up again. And it wasn't so siloed up when we had a work group around permanent housing, and we met regularly just to talk about how we're doing it. I feel like some of that isn't happening, and it would be helpful. I think I've learned amazing things. Like sometimes people might have to evict somebody and trade with someone other place that has to evict somebody, interesting stuff. But the how to, the intensity, especially since COVID, I think it has changed the way things work a little bit. And so I would like us to maybe consider, and maybe this is something that should go to the committee or something, but I don't want to, I'm not suggesting a formal another committee, and I'm happy to host it or somebody else can, but so how do we have a conversation so that it doesn't feel like it's contradicting what this group is working on, while just doing some basic, a community of practice around what works. And I was thinking about what Sean said and how many times a day I get things where I think I just need to become an assisted living facility, frankly. There's so much medical need. There's so much people who really just cannot take care of their daily living and trying to get that all met. And I'm worried as we continue to get more and more seniors, we're not talking about what we're doing. And we're not married to the systems that can provide the services there. So that's my self-serving need. As I'm trying to figure out like what's the best way for us to move forward as we continue to get, someone. Probably in the last month, we've housed 5 people that I expect aren't gonna live 12 months. And that also is gonna affect all kinds of things like our rates of how long we're keeping people housed and all of that stuff. So I don't know what to do about it, but what do you think?
Definitely a work group that can be formed, and the committee has been talking about a rapid rehousing work group also, so can definitely revisit with them to see, is this a combined group or is this 2 separate groups? Could it become like a hour-and-a-half work group where 30 minutes, 30 minutes, 30 minutes with a 30-minute overlay of both, potentially addressing the same types of issues?
Well, and I also think maybe even work group is strong. Maybe it's really a community of practice, like what maybe work group comes out of, like, these are the things we've decided we can take. There's not even conversations happening right now. So like, I don't know what we'd work on yet.
Office hours.
Huh?
Office hours.
Office hours. There you go. I don't care what it's called. It's on my board from day one, so.
All right, thank you very much. Okay, so we're gonna take a look at the sober living home and also the process for referring someone in from Solari. Also gonna take consideration into the permanent supported housing work group to get back to that collaborative process. All right, next up, we'll go ahead and talk. It's the board roundtable. This is an opportunity. We've actually modified the agenda a bit, and we're actually gonna ensue conversations around any announcements, events, challenges that you want to address, or opportunities to come together for a new idea. So do any board members have any ideas or thoughts that they would like to discuss? Go around.
Here's your opportunity to say, we should start a work group on that.
All after 2 o'clock. Like it got said it all is I'm counting as a win.
I have an announcement. For those of you who know Margaret Adams, formerly Margaret Coleman, she joined our team at the City of Phoenix last week, 2 weeks ago now. So we're super excited to have her. And for those of you who might not know her, she spent a lot of time at CSH and then was at Maricopa County where I first met her, and BSUW. She was at the campus. She brings a wealth of experience. So we're excited to have her join the City of Phoenix team. Oh, and she will be co-chairing the ESG subcommittee with TJ Reed. So thanks, Cleo.
I actually have an announcement. Last Wednesday, I think to be exact, the Governor's Interagency Community Council on Homelessness and Housing convened. There was representation from several sectors, DES, ADOH, Access was part of that. There are also juvenile corrections. So a good group of housing and developers came together and really discussed some of the initiatives, some of the efforts. The ideas they're proposed to establish a work group around data and accountability, outreach, public, private, nonprofit finance, and also leading and innovative practices. Now, these are proposed groups. I think more groups can be added, but these are just the ideas. The overarching group will meet quarterly, but there will be the subgroups that will be working on these different topics. They will meet more frequently. I think that's really it. Just kind of wanted to give you a brief overview on who was present. I think we also had some additional COCs that were present, both Maricopa and I think Pima as well. So that's it. Just wanted to give you an update on that.
I just like to keep talking today. I don't know. I didn't even have caffeine. Katie, I almost text you this, but I'll just ask it since this is a time of the agenda when I can. The Phoenix Rescue Mission from ground up presentation that they did. I was listening to it on the committee meeting again. Nate said some amazing things. I actually like typed up the quote, but is that something that this group would like, or we would benefit from seeing? Is it already agended for us to interact with that?
Not currently agended, but can add if you are interested in agendaing.
I would like, did anybody else see it? I just think it would be good for us to see what's coming out of that particular, the whole way they did it. And some things that's really showing about service resistance and some other things that I think would be helpful for us as we're thinking about like how we do what we do. So I would like to request.
Yep, definitely can add. That will also get posted to our website once it is publicly posted.
I just want to let people know that within the month in the city of Surprise, we'll be opening 7 family housing units. So we're pretty excited about that.
Excuse me, this is, can you hear me? This is Kent 40 on the line, and just wanted to kind of do a quick insert. I'm going to be working for the All Inside federal kind of initiative, and just wanted to, I've spoken to a few of the good folks here in the room today, and just wanted to just simply say hi. Not to make a big announcement or splash, but perhaps, and it could be an asterisk for the next meeting. It doesn't have to be an agenda item or a footnote or something like that. It can fit in there whatever way I can fit in. Just to talk a little bit more about that, if those that maybe have not heard of it, the All Inside initiative, that there's going to be a federal person coming down to be of assistance, and that's me in the over the coming year and maybe years. And it's specifically focused on unsheltered homelessness. So just maybe that's enough to say right now, but it's working through the U.S. Interagency Council on Homelessness, and Tamara Wright and Helena Schneider are going to become some of my points of contact. But I've been working with Katie and really close with her. And like I said, met a number of you. Hi, Natalie and Rachel and others. So good to speak with you again, and looking forward to working with all of you here in the next future. Really, my whole point is really to be a fly in the wall. And that's kind of what I've been doing for the last hour and a half. And that is my 701 number. I'm giving it away. I'm from North Dakota originally. So there's my North Dakota charm coming through, but it's not anybody from North Dakota tuning in. That's actually me, to make sure I'm not missing anything. So with that, I'm around. Katie has my contact information. Happy to answer questions offline, and I'll be meeting with you soon when I get boots on the ground. And incidentally, I do wear a uniform, so don't be surprised. I'm in the U.S. Public Health Service under the umbrella of the U.S. Surgeon General. The other team in this initiative, it's Dallas, Chicago, Seattle, Los Angeles, the state of California, and then Phoenix is in this initiative. So I happen to be the only person in uniform, but we deploy all the time. So this is kind of extended deployment, and for no other. Couldn't think of a better reason to do so, and happy to be able to pull my weight, whatever way, shape, or form I have. So, Natalie, is there something you would like to add or question?
So the Mesa team got the opportunity to meet with Captain Ford's this morning, and just for everybody to understand, I think because both Rachel and I are on the committee, I do think it would be a good thing for she and I to collaborate, and during the board roundtable, bring an update to this team and take back any feedback that you've got. The way this is working is it's an agreement with the USICH, who identify a person who becomes our link to all of these federal government agencies that are working in homelessness. And the idea is that they provide us technical assistance. So this isn't for funding, or that kind of support. This is about, okay, what are some of, I'll just give you an example. Are there barriers that are keeping you from getting things done that at the federal level, they can talk about and make better for us. So Phoenix is involved, Mesa is involved, the county is involved, and then of course MAG is helping with all of the coordination. So I do think it would be a good conversation to continue and to bring back to this group from time to time, but we're really excited to work with Captain Forbes. He also does have this public health perspective and background, and I do think that as the opioid use disorder settlement funding comes down the ranks, and we learn more and more about this intersection with homeless. We were doing some studies in our own community court, and I shared this with him this morning, but 4 out of 5 participants in our community court who are homeless also have some kind of a drug or addiction issue. And so it really is connected to the work that we're doing, and could possibly be another subject that we continue talking about as we move forward. So, and then the only other things that I wanted you guys to know is, in addition to what you guys are opening up in Surprise, A New Leaf is working on expanding their shelter or their permanent supportive housing at La Mesita. And Mike can talk more about what that is, and he's going through that process right now. We are also working very hard to expand the East Valley Men's Center campus to include 30 transitional housing units. And so we are going through the council use permit process right now for a hotel that we're also trying to buy, but the East Valley Men's Center and some of the dynamic there is coming up within those conversations. So we are being challenged right now politically. And so some of the information that we got today, 21 coming in and 10 going out is really helpful so that we can continue helping our local officials understand the need and that it exists, and that cities and the county have a role in this, and it's not going away.
Thank you, Natalie. Any other updates or comments? All right. With no further business, this meeting is now adjourned.